Welcome, Donald Norcross here. Today I'll be talking with local education leaders about measures our schools are taking to reopen safely in the midst of a pandemic. Yes, the coronavirus is impacting us in every part of our life. But I just want to give you a quick indication of how big this is. New Jersey has 584 school districts, more than 2,500 school buildings, 116,000 teachers, and 1.4 million students. And we need to create a safe learning environment for each day. Joining me today is NJEA President Marie Blistan, New Jersey Work Environment Council Heather Sorge, an organizer for Healthy Schools Now campaign, and Delsea Regional High School teacher Tina Dare. Welcome and thank you for joining me. Every parent, every educator is feeling that uncertainty, that anxiousness that's going on about schools. First, it's about safety, yourself, your children, your loved ones, and certainly those around you, your colleagues, your workers that are with you each and every day. And we're about to put them back in a school environment. So we want to make sure we're doing this right, that they're safe, and then the education process can take place. We must make sure our schools are safe. I'm an electrician by trade. I know what OSHA, the Occupational Safety and Health Administration, has done, has literally saved lives. The more enforcement, the more standards they set. In an environment that I used to work in, it was the difference between life and death. Before we can recover, we must properly respond to the public health crisis and protect our teachers, the staff, and students. Over 100 days ago, we passed the HEROES Act to provide funding for schools so they can safely reopen. Over 100 days ago. The House also passed Moving Forward Act that included the legislation that I sponsored that provided $130 billion to rebuild and safely reopen America's schools. Unfortunately, the Senate has done nothing. Still, to this day, nothing. All this time we could be working in our schools. That summer recess is the time that you work in the schools to physically change the structure. So Marie, again, thanks for being with us today. As we prepare for the reopening of schools, what investments do schools need to make on their physical infrastructure so that when the kids come back and the teachers come back, that they're all safe?
Well, Congressman, first of all, I want to thank you on behalf of our 200,000 members for hosting this call and for inviting us in. I'll also want to thank you again for doing the statewide call that you did about 2 months ago, telling our members the work that you and your colleagues have been trying to do in DC. We find it quite appalling. We're seeing the effects here in the state of New Jersey as well as nationally. I'll also say that there isn't anyone that wants to get back into our classrooms, on our school buses, in our cafeterias faster and more than what our members do. This is what we do for a living. And it's not been easy on our parents, on our students, and on our members trying to work remotely. But this pandemic, it's a worldwide crisis. It kills people. It has more effects on people that we're still trying to find out. And so we have to, and we do take this quite seriously when we tell students and parents to drop their students off to us. The needs that you're asking for regarding our school, I know that you are aware of many of them because you have made yourself available to ask those questions and to go into those buildings. You know, you noted that there are 2,500 school buildings in the state. Some of them over 50, well, about 30% of them are 50 years or older. And so the infrastructure is in need of some help, especially when we're dealing with the ventilation in our buildings, when we're dealing with some windows that, in the infinite wisdom of people before us, built schools where they sealed the windows shut. And we now know that if we're going to be inside, it's critical that we have a free air flow from the outside, that windows are going to be open, and we have an HVAC system that is going to be able to trap as much of the virus as possible so that it's not easily transmitted in those buildings. But it's more than that. We need infrastructure that's going to allow us to have school nurses in our buildings, that's going to allow us to have training and facilitation with departments of health for contact tracing. We need infrastructure that's going to bridge actually the digital divide and have hotspots available for the internet service and provide personnel inside of those buildings for what we call crisis intervention teams for kids and for families who are dealing with even more outside pressures that we do normally deal with when we're in the buildings on a regular basis. This pandemic has put everything at a whole new level.
Yeah, it's a challenge. And from a parent's perspective, grandparents, the lack of predictability, we're all hoping to get back to that new normal where you can be safe and learn. But before any of that can take place, you got to make sure the kids are safe, that you're safe going in each and every day. So Rebuilding, Reopening America Schools Act, we passed that for 2020 funding so that the guidelines, and I use the word guidelines that CDC put out, are being followed. I mentioned we had over 2,500 buildings, close to 600 school districts that the Department of Education wanted to review their plan. Have each of the buildings been inspected as far as you know, and those ventilation systems?
They haven't had a whole lot of time to do it, Congressman. By the time that we found out the newest protocols, and that was in July, when we had a 90% increase spike of children who had been diagnosed with COVID, if you remember that. They started to look at the buildings, and people felt pressured to look at the date on the calendar in September. It normally would be right around Labor Day when we go back to school. We certainly know that when we hit the stores and we see the back to school items. But this year, we've been very adamant that we can't look at that date. We have to look at data and then determine when that date is that we can open those buildings safely. Many of the buildings and the administrators have scrambled to have their systems checked. Some have been able to put some things in place that at least will be an upgrade. Some have asked for 2-week, 4-week, or even 6-week, or even a full marking period in order to put those protocols in place. And remember, we're not just talking about the buildings, we're also talking about school buses who have to transport those students. We're talking about plexiglass, I don't want to use the word shield, but some type of a divider so that we can work with our most high risk students in our schools. Because what we know is that if we don't have that money, we're looking at school districts who are already looking to lay off critical personnel that would provide those needed services for those students. And I'm going to go back again to the school nurses. We have approximately 300 buildings that we already know that don't even have a school nurse assigned, part-time or full-time. And so some of that money that you've been advocating for in DC would be able to come to our state and into those schools so that we could have a school nurse available.
So we passed the CARES Act several months ago, and that has been the bulk of the money that has been used by the states and certainly New Jersey. We hear so often about the digital divide. I live in Camden City, and certainly each child needs to have a device. If you have brothers and sisters at school at the same time, it won't work, and you need access to the internet. And in Camden City, where we were very challenged, corporate America from the city got together $400,000 along with some of the help that came from the teachers to try to take care of those devices. It's not unique to Camden. This is happening across the state. And what do you see happening for the first part of the school year? Is every kid going to have a device?
Well, we don't. Very good question. And again, thank you and to all the folks who did contribute to the Camden City Schools. We were made aware of that. Governor Murphy, Senator Sweeney, Senator Ruiz got some money together, additional money, and had some help with philanthropic funds to try to provide those devices. Here's what we found. We're finding that they are in short supply, that the districts have to apply, to get them, and they're not available for everyone yet. We're also finding out that even if they have them, we don't have the hotspots available. You know, you were right on when you said about the internet access. Internet used to be considered a luxury. Today, that's not a luxury. It is a need. It is a utility, as far as I'm concerned, just as necessary as running water is, or electricity is in our homes. And our state is not north, south, east, and west. As you well know, New Jersey is very, very varied, including mountains and flatlands. We don't have that internet access available to us, and we need the funds to work with those companies to provide it. And I'm also going to add, you noted that the money would help our 600, almost 600 school districts. Remember, we have our community colleges. And when we talk about the role that community colleges play, especially in Camden County and in Essex County, where they are servicing people who are disadvantaged economically, people of color who need that lifeline. We are in short supply here in our state for that funding, and we need that funding for them as well. I noted when I ran around the state in the spring, I was first focused on the pre-K to 12 student divide. We identified eventually over 230,000 students out of that 1 million, 1.4 million.
Wow.
Without a device or without access to internet. But what I found additionally, when I talked, we represent our community college members as well. I found out that students in the community colleges were also left out, because when the colleges closed up, when the state closed up, and rightfully so at that time, they needed to, the college students, some, did not have a place where they lived where they could access internet. So where did they go? They went to the Starbucks or other coffee shops, found that they were closed, and they had no internet access. So I want to also put into the room, again, thanks to your work, that when you're advocating for the CARES money, it's going to go pre-K to 12 plus into our community colleges, which are probably going to be the biggest lifeline that we're going to need as we get out of this pandemic.
You know, we're working pretty well here with our connection, but when it freezes or goes off, I can remember back anytime the teacher left the room, things change a little bit. I can only imagine when you freeze up on there, children will be children, and that's something that hasn't changed. Let me just shift back to where we are talking about the physical structure. Heather, you're with New Jersey Work Environment Council, somebody that I've worked with literally over the last quarter century when I was in New Jersey. You're with a program that talks about healthy schools now. Where do you see the biggest priority in the buildings for schools taking place? What area would you say your biggest concern is?
Congressman, you know, for both Healthy Schools Now and the New Jersey Work Environment Council, you know, our number one priority always is the health and safety of, you know, our staff and students. You know, districts, unfortunately, were never provided the strong federal guidance, you know, or state guidance, honestly, that was really necessary to create the plans that were necessary to adequately protect staff and students. You know, and because of this, WEC, Healthy Schools Now Coalition, NJEA, and the National Healthy Schools Network came together and released a report entitled Call to Action, The Pandemic v. Schools, which has called on states to produce model infection prevention and control plans, which local districts can adopt. You know, this report addresses exactly what we were talking about, HVAC and ventilation, cleaning and disinfecting procedures, screening, illnesses, mask, PPE, and services that, you know, children need with health and learning issues. And as Marie said, you know, we need to remember that the schools that we're talking about in New Jersey, our buildings are, you know, on average 50 years old and 4 times more densely populated than office buildings. You know, and these issues that we're addressing, they're overcrowded, deferred maintenance, strained ventilation, heating and plumbing issues, and electrical issues. So these are issues that were around long before COVID-19 reared its ugly head. And now they've just been highlighted and exacerbated by the virus. So things like poor ventilation, they actually make the virus spread faster. which is a huge concern. And it's a serious concern because on any one school day, 20% of the US population is in school. And schools are where children spend their most time other than the home, often like 30 to 40 hours per week. So, like adults, children, can shed and transmit the virus, yet as we know, they may show no symptoms. So, to reduce that community spread, schools should not be open without those strong health and safety measures in place.
So a couple of things I want to touch base on. There's standards and then there are guidelines. Right now, we're presently under guidelines, which means this is what we think you should do, but there's no enforcement mechanism. OSHA, the way I described it before, covers private employees. Myself as an electrician back then, but doesn't cover public employees. You touched base that was up to New Jersey. Expound on that, what New Jersey can do versus what we're fighting for on the federal side.
Well, I think, that this goes to the point of, looking to have, possibly to implement a standard, such as what they did in Virginia, to have a standard in place, that would be an emergency standard, which we could put into place, since OSHA has not put that standard in place. Which would allow us to enact an emergency standard, which would allow us to protect our workers and protect our educators, in absence of that federal action.
You bring up the point Virginia passed it. They put together that emergency temporary standard and followed what has been ready to go since the Obama administration, a standard that they could follow. Hospitals have been doing it as part of their ventilation systems. But I guess the idea of making it a standard so you have to do it versus a guideline, you might do it. And why don't you touch base on that, a standard versus a recommendation?
New Jersey did take steps, to protect workers early on, right? So Governor Murphy had issued Executive Order 122 early on, which required essential employees to have, control plans with social distancing, face mask requirements, notifying workers of any known exposure, at the work site, which was good steps, but it needs to really to be expanded, right? As the economy is opening back up. So if we had if we had an emergency temporary standard, this would actually be something which was enforceable, which would, guarantee protections and would actually, make those things, which would back the employers up to make sure that they had protections.
Yeah, we want to believe everybody would do the right thing, but
Right.
as that saying goes, trust but verify, and
Right.
that's something we need to do. Thank
Right.
you. Tina, you're on the front lines literally every day. You see, you feel what's going on. How are your colleagues preparing for this? Will you have discussions with them? I guess it depends on where they come from, their age, their health conditions, and they want to go back and they want to be with their kids. What are they saying?
Well, first, I just want to say thank you so much for having this discussion with us today, because it is such an important discussion that we're having that involves, like you said, so many different people across New Jersey. So I thank you so much for having this discussion. And, I have to say, I am a 22-year teacher, and I truly feel like I'm about to enter into my first year again. And, just like my first year, it's exciting, it's scary, and at times it honestly feels extremely overwhelming. And I think that's how a lot of the staff is feeling right now. And, honestly, I don't think anyone stopped working when this year ended. Our teachers, our guidance counselors, our nurses, as well as our ESP members, like custodians and secretaries and bus drivers.
Sure.
They have been working incredibly hard throughout the summer to prepare for this school year. So we've really been working as a team. And, as a teacher, I can tell you, we've been learning new techniques to find ways to engage our students under these extraordinary conditions that we're in. And, every teacher is working to continue to present innovative lessons like we have always done, but under a completely different situation and using completely different resources than we've ever used before. And, we truly do this because we love what we do and we love our students.
We understand that, and NJEA is a voice for all the teachers, all the staff, and for many cases, you're also that advocate for students. As you re-enter, and you were just talking previously about some of the things that are happening, what's going on with you, what's your biggest concern from the classroom side of this? Assuming just for a moment that you're not going to be doing digital, there's going to be some sort of live interaction going on. As you walk into that room, what's that concern that is knocking on your door?
So there are so many. I'll tell you, my first is safety, and everybody has mentioned that, and Marie has, and Heather has, and you've talked about it, and that safety is at the top of my list. And it's not just the safety for our staff, but it's for the students. It's for everyone entering into that building. I'm concerned about the ventilation and the class sizes, and we do have such aging buildings across New Jersey. So safety is my number one, but honestly, a close second is the socialization and the mental health of our students. This has been such a difficult time for so many of them, and they really do depend on so many resources at our schools. We don't just give them an education, we offer them so many more things, and I'm really concerned about that. And I'm not just concerned about the mental health of our students, but also our teachers and our ESP members. I'm concerned about their mental health. I'm worried about teacher burnout. I'm worried about recruitment of future educators. This is an extremely stressful time for so many people. And I gotta say, probably my final biggest concern is making sure that we have an equitable education for all the different student groups. We're gonna have in-person students and virtual students and students with all different backgrounds. But, at the end, these are challenges that as an educator, we want to continue to find solutions. And we want to work with the administration in our building. And not only with them, we want to work with our communities in order to make things work during such a crazy time.
Yeah, that transparency is so important because we understand things are changing. This is new to the medical professionals, certainly is to you. When you're in classrooms, you see your students, you feel what they're going through. That's got to be a real challenge online. Is he nodding off? Is he disrespecting somebody, not paying attention? How are you able to deal with that? Can you pick up those nuances online?
It's definitely more difficult. We all know that the best education is an in-person education, and none of us are denying that. It's just that we really have to worry about safety first. So, you're right. Being on a screen, you don't pick up the same things from kids. And that's where we are also within our schools getting different trainings on being aware and watching for those signs in kids so that we can do everything we can to help them and to, move them forward in this situation.
We're hearing stories that parents are being told that their kids should bring in Lysol wipes and they should bring in the hand sanitizer. And that's a concern to me as a parent. Like, I don't know what other people are being handed to bring into school. Is it what it says it is, or is it something else? And I'm a little concerned. Heather, you're dealing with healthy schools and the nuts and bolts. What do you think parents should do if they're asked to bring in things? Are there any guidelines or standards on that?
Well, a few fun facts, Congressman. I'm not an industrial hygienist. I do get the opportunity to work with some wonderful hygiene consultants. But I will share. First of all, masks. In the traditional sense that we're using them in school districts are not PPE. The only masks that would be PPE are like your N95s, which would be fit tested. But the other, some of the other, like the face shields and things like that would be. Lysol wipes and things like that, technically should not be brought from home. The only things that should be used in the school in terms of cleaning and disinfecting are chemicals, which would be purchased and approved by the school district. So really, parents should not be sending anything into the school district. We should only be using chemicals that are on an approved list. And just a fun fact about Lysol wipes, maybe it's not so fun. is that Lysol wipes are actually labeled as a pesticide by the department, by the DEP. So children really should not be using Lysol wipes. The only thing children should be cleaning their desks with, as a matter of fact, when it comes to the school, is soap and water.
So interesting, because Marie, we hear every year teachers reaching into their own pocket to help out students in the classroom. And that's just so kind. But the idea of having every child told to be brought in something seems a little bit off to me. What are you hearing from your teachers from around the state? Are they being asked to pitch in here on this sort of thing?
Yeah, 100%, Congressman. And having been in the classroom well over 35 years, and I taught pre-K to through 12th grade during that time, kids are kids. That's why they're still under adult supervision. And to try to leave something as critical and as life-saving as a mask to a child is really ridiculous. And it is just, it's not feasible that that is going to work. I want to add that as Heather noted, there is a difference between PPE masks and the cloth masks. And the PPE masks, which for some people are really needed, are extremely difficult to get. One of the things that I learned was that the Department of Health does not prioritize, or the distributors of that equipment does not prioritize schools. They prioritize hospitals, nursing homes, as well they should. They are in short supply. We can't get them. As regarding the cloth masks, our members have gone out when they've heard that the district cannot afford to get the mask and or that they can't find the mask. They are scrambling to try to bring in masks. I was asked if I were in the classroom how many masks I would have on hand. And I said, without reservation, 2 per student that I was responsible for at all times, because I know that things happen with kids. And you noted earlier, kids are kids with masks. They're going to use them for certain things. They're going to get dirty. They're going to sneeze on them, and it has to be replaced. And we don't have time to wait for another day. We don't have time for students who are not able, for whatever reason, to sanitize a mask each night. That we should providing those. And I would just say that I also found out in the last 2 days, actually, that many of our districts had gone out and bought the face shields. And the latest information is that that is not comparable to even a cloth mask, of which we know that we need, as you have well said. And there are some schools that didn't invest in any cloth mask because they thought that the face shields were sufficient. And now they're showing without doubt that that is not going to stop the transmission of the virus inside of those buildings.
It's both the face covering, which is different from the PPE, but still 1.4 million kids in school with teachers times at least 2 a day. If you go to lunch, what happens? You drop it, it becomes a rubber band. And then for teachers, if they are in a compromised situation with some pre-existing condition, they will probably end up wanting to wear an N95. Tita, what was your plan to wear? And do you know of any of your colleagues who decide, because they're now, and some suggestions are for the eye coverings also?
So at this present time, I'm preparing to wear a cloth mask and have extras in my desk throughout the day because, like you said, even as an adult, things happen, and I want to be prepared with multiple masks at all times. They are not providing us with any face shields, but I do believe that, you know, we have to start looking toward what is going to be the most protection for our members. And we really do need to look at that. And, you know, you guys all talked about like kids in the classroom, and luckily I teach high school, and I think they're gonna be pretty good at keeping them on. I don't think they're gonna do a good job at washing them every night. Like you guys said, I don't think they wash their gym clothes for weeks. So I'm a little concerned about that. I can't imagine being a kindergarten teacher or a special needs teacher, because I think for those students, it is going to be next to impossible to keep a mask on all day. So I worry about our staff that gets involved and teaches those younger levels.
And who is supposed to say whether that face covering is one that qualifies for one. Remember, they don't want the ventilators on them now. Who becomes the police officer for the right mask or face coverings? Just challenges, but the idea of relaying to parents that your concerns and certainly what you're understanding, it gives it that transparency that we're all in this together. Mm-hmm. And I think that's critical, and we really appreciate you coming together to share these things. Any last thoughts, either for students, your colleagues, or parents?
Congressman, I would say that when we're talking about all this, that our custodians and our maintenance folks who are tasked with what we're now calling deep cleaning the schools after the staff and or the students leave. In some cases right now, we have schools that are closing completely on a Wednesday, making that Wednesday up, so that it would be all remotes to do that deep cleaning, that we know that those folks need even more equipment. And you mentioned goggles. I think that when we look at deep cleaning, that they need to have all of their clothes changed so that they are only using those clothes. You know, I had a little bit of experience through WAC with people who had been afflicted with asbestosis. And a little known fact that I found out was not so much the people who worked in the factories were affected. They knew to take their clothes off before they left the place, but they brought them home. And in many cases, I know of one particular family where the wife did the wash, and she wound up with asbestosis, not realizing that every time she touched those clothes, she was inhaling those fibers. I worry about our maintenance and our custodian folks who are doing that deep cleaning, and we are advocating for full garb from head to toe, just as they would do in a hospital when they were cleaning and sanitizing. So again, thank you.
You mentioned hospital. Hospitals have a rule: treat everybody like they have it. And if you do that, you'll keep those standards across there. But you bring up a great point. What do? Bus comes, pick up the kids, drop them off, and what do? They go to the next group of kids. Are they going to clean between each one of these? Now, I know these discussions have gone on, but those are the concerns that I hear from parents, and absolutely drive them nuts, because not everybody's been told this is what we're going to do. So, last thoughts, Tina, Heather?
I do actually have a last thought. I had the Department of Health actually at my coalition meeting this past Friday. Dr. Adenauer was there, and one of the questions that I asked him was posed by one of our ESP members, by one of our bus drivers down in South Jersey, as a matter of fact. And it was in regard to bus safety and COVID-19, because the concern is that, buses are very hot. They're metal structures on wheels, and a lot of these buses are old. They don't have air conditioning. They don't have fans. Many of these buses don't have windows that open. They're not operational. And these buses have idling laws that are in effect, and they're waiting for students on these buses, and they're wearing masks. There's grave concern that, they'll be driving a bus and, someone will pass out because there's not fans that are on these buses for these bus drivers while they're wearing these masks. So, I kind of looked to see if there was any guidance or any temperature, recommendations, guidelines that we have or that could be instituted, for protections for our ESPs, for our school bus drivers. For COVID. I think that's something that needs to be addressed, because, should a bus driver, have a heat exhaustion incident behind the wheel with a bus full of students, that's going to be catastrophic. So, it's certainly a safety concern, for us, that moving forward.
Absolutely. Thanks for bringing that to our attention. Tina, last word is yours.
I'm going to say that I would love parents and community members to know that we as teachers, we always joke it's like a calling. We love what we do. We love working with students. So this has been tough for us to not be able to be in our classrooms and with our students, but we want parents to know that we're going to do everything in our power to make the best of this situation and give the best possible education to every single student that's in New Jersey.
Together we can do that. Again, I want to thank each of you for coming on and sharing your views and your experiences. My office is now open. We're dealing with literally thousands of cases. So any questions that you might have, 427-7000, it's area code 856. The one thing I'll say, wearing a mask saves lives, and it's also a sign of respect to you and to others. But together we can get through this. Thank you for being with us, and look forward to talking to you all of you again shortly.